Hello everyone. I'm Dajao. So today I'll be performing musculoskeletal system. First is identify the patient. Explain the procedure of this assessment, and then one-hand hygiene. Then assist the patients to undress if needed and patient gown then for the patient survey overall of hygiene and appearance. First and then next is assess for neurological system. First is evaluate the patient mental status. I assess the mental status of the patient, then evaluate the patient orientation, person, place, and time. What time next is then evaluate the level of consciousness, and assess memory, immediate recall or past memory. Then next is assess for patients abstract reasoning by asking them to explain the proverbs such as an early bird catching the worm. Explain the words. The next is test for cranial nerve. For cranial nerve is ask the patient to close and next is follow by following the patients by letting them follow my command. First, raise your left hand, then the right hand. Next is for test for cranial nerve. As a patient to close yung eyes, then upload one nostril, and identify the patient to the different smells such as coffee, chocolate, and alcohol. So other side then next is ask the patient to close again sa yung eyes. Then using the finger or applicator kanang trace a one-digit number on the patient's palm, then identify sa patient kung what happens. Other hand. And next is as a patient, as a familiar, then tap the hands of, place the hands on the patient's shoulder while the patient shrug the resistance. Then shoulder to cheek. I place the cheek on the patient. I place your hand in the patient's cheek, then have the patient push against. Next. touch his or her chin on the in her chest. Then the next is assess for patient deep reflex. So tap on the reflex that place place your hands on the patient's wrist. Then next is anti-genital area. Then okay, place your pass on the eye space. Then identify this subject. Next is assess then for deep tender reflex, first is the wrist, then the antecubital area, then the tricep tendon, then the patella, then the Achilles tendon. Then the other side. Then the patella.
And then the shoulders, take off ears to shoulders, and tip the head back as far as possible.
Tapos ka, oy.
Next is stroke the whole eyes of both the patient and of the
Okay, after that, again, next, close your eyes and then have them
Next is the patient for dorsal reflex and plantar reflex.
After that is removing the test patients. Leave the reflex and the patient's wrist with the reflex finger and
And next is as the patient, as needed, position the patient to stand position.
with the antecubital area of our patient and tap it with the reflex finger and then
And observe the walk of observe the walk of the patient. If
then we're going to do the triceps and the biceps and The walk of the patient.
Of the patients in
Now we're going to get the patient nakalong. First is now after tricep, we're going to do padalia. So tap it with the reverse hammer and do it over.
next is kanang for room bridge test. Room bridge test position the patient to stand straight, then with the feet together and then with arms outside. Then ask the patient to close eyes, then wait for 20 seconds and observe the patient can sway or maintain balance. Can you close your eyes, please?
Dai, pagagod ang take paliw. Tanong.
Next is assess for musculoskeletal system. Ask the patient to extend arm, then palm up and down. Okay. Next is ask the patient for flex the upper arm to resist the examiner's hand. The examiner's next is inspect and palpate the hands, the elbow tendons, and the wrist. Then have the patient squeeze the two fingers. Then have the patient to perform a straight leg test, one leg at a time. Other side. Next is ask the patient for an upper raise. Next is ask the patient to raise three thigh. As our production, ask the patient for no funny legs, to test the leg for abduction and adduction. So, for your leg with your knee. Medially to laterally. Then next is ask the patient to raise your thigh with the hand of resistance. Raise your thigh. Then other side. And next is assess the patient to optimal position, then assess to remove the patient's gown, then perform hand hygiene and document.